Hello, welcome to Module 3 of the Elko County Health Board Toolkit. My name is Valerie Quape, and I'm an intern with the University of Nevada, Reno's School of Medicine, Office of Statewide Initiatives. During this video, we'll be taking a closer look at Nevada's public health system structure and some of the differences between the organizations that are involved. We will also discuss how NRS, or Nevada Revised Statutes, delegates authority to local boards of health and other health agencies throughout the state. Lastly, we'll discuss some of the resources available to local boards from the Nevada Division of Public and Behavioral Health. As discussed in Module 1 of this toolkit, Nevada's public health system has been described as either mixed or largely decentralized. This is because of the coverage of the 3 existing local health departments or districts at the state's population centers, while the State Health Authority is responsible for most of the public health services provided to the rural and frontier counties in the state. There are currently 4 public health agencies in the state of Nevada. First, let's talk about the state. The state-level public health agency is the Division of Public and Behavioral Health, or DPBH. Although DPBH oversees rural and frontier public health services, the office is located in Carson City, the state's capital. Next, let's discuss the 3 local-level public health organizations. As previously discussed, local health departments are not satellite offices of the state public health agency, which in this case is DPBH, but are instead branches of local government. Carson City Health and Human Services serves the smallest jurisdiction of the 3 local agencies and is also located in Carson City. Southern Nevada Health District, based in Las Vegas, serves the largest jurisdiction of the 3 local health authorities. And finally, Washoe County Health District is based in Reno and is another large local health authority. Although the rural and frontier counties in Nevada are not currently overseen by health departments, they are required by the Nevada statute to have a local board of health that can communicate with DPBH or any other organization that may be providing services to their counties that relates to public health. At the time of this presentation, there are 4 known active boards of health in these Nevada communities: Churchill County, Douglas County, Elko County, and White Pine County. Today's presentation is going to be focused on Nevada Revised Statute, or NRS, particularly how it is outlined in Title 40, Public Health and Safety, Chapter 439, Administration of Public Health. Because the Elko County Health Board is a county-level organization or entity, we're going to be focusing on local administration of public health at the county level, which is NRS 439.280 through 439.4905. There are several different types of board of health defined by Nevada Revised Statute, or NRS. State boards of health are defined by NRS 439.030 through 439.140, and again in NRS 439.150 through 439.200. Local administration of public health is discussed in NRS 439.280 through 439.4905 regarding county boards of health, and again in NRS 439.420 through 439.470 regarding city-level boards of health. First, let's take a minute to talk about the state's Board of Health. The members of the State Board of Health are appointed by the Nevada governor and combined to become a 7-member board. These members include 2 physicians, 1 dentist, 1 veterinarian, 1 nurse, 1 general engineer or building contractor, and finally 1 member of the public. It should also be noted that all medical professionals serving on the State Board of Health must be licensed in the state of Nevada and must have been practicing in Nevada for at least 5 years. According to Nevada Revised Statutes 439.150, the Nevada State Board of Health is declared to be supreme in all non-administrative health matters. It has governmental supervision over all matters except for administrative matters and as otherwise provided in NRS 439.950 to 439.983, inclusive relating to the preservation of health and lives of citizens of this state, and over the work of the Chief Medical Officer and all district, county, and city health departments, boards of health, and health officers. In other words, the State Board of Health governs the local boards of health, as well as their respective health departments or districts as applicable. Pertinent statute relating to local boards of health and health departments or districts includes NRS 439.280, which relates to the formation of a county board of health and the appointment of its county health officer. NRS 439.361, which relates to the formation of a district board of health and the appointment of a district health officer in counties whose population is 700,000 or more. NRS 439.369, which relates to the formation of smaller district boards of health and the appointment of their health officers in counties whose population is less than 700,000. And finally, NRS 439.471, which relates to the formation of a city board of health and the appointment of its health officer. Other statute that relates to the work of local boards of health or health authorities includes NRS 439.471 regarding mosquito abatement and other nuisances, 439.4797 that relates to controlled substances, 439.480 which delegates authority in all public health matters to a local jurisdiction or to the local health officer, and 439.4905 which outlines the requirements associated with local jurisdictions submitting payment to the state health authority for public health services rendered, as well as procedures for submitting proposals for completing those services at the local level instead. In addition, language from NRS 439.4905 regarding services refers to other statutes relating to health and welfare. These chapters are NRS 441A, which relates to protocols and responsibilities associated with infectious disease testing, reporting, and potential quarantine procedures for state and local health officials. NRS 444, which relates to sanitation. NRS 446, which discusses regulations regarding food facilities of various types, food preparation, temporary food establishments, permitting, and enforcement. And finally, NRS 583, which relates to the production and quality of meat, fish, produce, and eggs. Let's take a closer look at county-level boards of health, such as the Elko County Health Board, and how they're able to govern, as well as how they are governed. First, let's talk about who oversees the functions of the county-level boards in Nevada. According to NRS, the County Board of Health shall be subject to the supervision of the division, here meaning the Nevada Division of Public and Behavioral Health, and shall make such reports to the division as the State Board of Health may require. County boards also have duties and powers associated with their position. Local level duties include overseeing sanitary conditions that may affect the public's health, working in conjunction with the State Board of Health to develop and implement county-level codes that enable the prevention and control of contagious or infectious diseases, and ensuring that all applicable county regulations are filed with the county clerk. Other powers given to county-level boards include activities associated with nuisance abatement, potential instances where quarantine is necessary to prevent the spread of disease, and establishing fee schedules for health permits and other licensures related to public health. When we talk about the three local health authorities, it can be confusing to hear two called districts while one is referred to as a department. Although this is a complicated subject, let's discuss some of the differences between statute that defines each to provide some clarity. First, let's talk about health departments and their boards of health. There are two types of health departments associated boards outlined in NRS. County health departments, defined in NRS 439.280 through 439.360, and city health departments, defined by NRS 439.420 through 439.470. One of the most striking characteristics that set health departments apart is that they are branches of only one governmental agency. This means that they would be a department of a county's government or a city's government. The health department is overseen by its respective county or city board of health and can contract with other local government agencies to provide services within that jurisdiction, cities or neighboring counties, but the official jurisdiction of the department is confined to that of the branch of government under which it falls, unless additional authority is delegated to the department by the state health authority, or in this case, DPBH. Currently, the only example of a health department in Nevada is Carson City Health and Human Services. Carson City, Nevada is a consolidated municipality, meaning that it is both a city and a county in one governmental entity. Although Carson City is referred to as a quote-unquote city, the health department and its board of health function as county entities. As we move on to our discussion regarding health districts, it's important to note that NRS has separate definitions for health districts whose population is above and below 700,000 people. To start, a health district of any size jurisdiction is formed by two or more governmental agencies working in conjunction to form the district. This is often a county and one or more cities within that county. When a health district is formed, any previous city or county health boards or departments are abolished. The health district itself is overseen by the District Board of Health, which has more broad representation than either city or county boards of health, and may work in conjunction with a district advisory board to ensure that a variety of perspectives are taken into consideration when writing or implementing new or revised public health programs and policies. There are two examples of health districts in Nevada. The first of which being Southern Nevada Health District, which has the largest jurisdiction and falls under the definitions outlined in NRS 439.362 through 439.3685. And Washoe County Health District, whose population allows it to be defined by NRS 439.369 through 439.410. Now that we've talked about some of the differences between the formation of health departments and health districts, we can discuss what services they provide to their jurisdictions. Over the course of the development of this toolkit, I have been asked by members of the local public health system about what services are conducted by the 3 local health authorities in Nevada. The programs and services provided by the locals varies among them, based on federal and state grant funding, local funding streams, and community needs. Some of the common programs offered at the 3 local health agencies include public health preparedness, which includes the development of partnerships among various sectors of the community to develop plans that can be used to protect health in the case of various types of emergencies. Administration, which often includes not only the organization's leader or leadership team, but also programs associated with community health assessments and resulting improvement plans, organizational strategic plans, quality improvement, performance management, training and workforce development, and others. It is also common for the 3 local health authorities to provide health education services, particularly those regarding the prevention of chronic diseases. Specific program areas may include tobacco, diabetes, obesity, physical activity, HIV and AIDS, and others. In addition, all 3 organizations provide community health nursing or clinical services. The title varies here by organization. These services usually include immunizations, reproductive health screening and services, family planning, or other services related to maternal and child health. Environmental health services are also provided by all 3 agencies. These programs include, but are not limited to, permits and inspections relating to restaurants, public pools, septic tanks, tattoo and piercing establishments, and other relevant institutions. Epidemiology, which is the practice of collecting data regarding reportable diseases, monitoring that data for outbreaks, and working to minimize the spread of diseases in the community, is conducted at all 3 organizations. The list of programs I have outlined here are not exhaustive, nor do they represent the internal divisions under which the programs are organized at each organization. For example, at Washoe County Health District, there is a robust air quality program that has its own division, while there is no official air quality program at Carson City Health and Human Services, and related issues are handled as needed by the Environmental Health Division and Public Information Officer. But what about the rural communities? Let's talk a little bit about the programs that may be offered by DPBH to the rural and frontier counties of Nevada. First, it should be known that the services provided to these communities is based upon each county's contract with DPBH, and thus may vary between counties, given the amount of services that are being paid for. However, some of these program offerings include epidemiology, environmental health, community health nursing, and other programs and services as decided upon by the state and local entities. Although the majority of the content discussed in this presentation was taken from Nevada Revised Statute, other resources are available to help glean further information regarding the programs and services offered by both the state and local health organizations in Nevada. Included alongside this presentation is a publication from the Nevada Division of Public and Behavioral Health that outlines its current program offerings. In addition, specific programmatic and contact information for the 3 local health organizations can be found at their respective websites. Here they have been listed in alphabetical order: Carson City Health and Human Services, Southern Nevada Health District, and Washoe County Health District. If you have any questions, comments, or concerns, I can be reached at the following email address for the remainder of the summer. Thank you very much for your time and attention.